Hi, welcome to this micro lecture from the ACE Your Clinical Placement series about acting on the social determinants of health. My name's Matthew Links and I'm Discipline Lead for Medicine Placements at Bond University here on the land of the Common people on the Gold Coast. This lecture is aimed at medical students on clinical placements, and I'm grateful for feedback from other faculty, but the opinions expressed are my own. So holistic care takes into account the context of the patient's care. WHO defines the social determinants of health as education, access to care, physical environment, social and community context, and economic stability. The social determinants of health determine much of the inequity of healthcare, and equity matters. This is demonstrated by this graph that shows the difference in mortality between groups of the highest and lowest socioeconomic status. In your clinical placements, so stop and think. In what ways is this patient advantaged or disadvantaged? And is this patient getting a fair go? Well, here are 5 things, 5 A's, you can do to help your patients get a fair go. The first thing is you should assess always. This is the foundation of the other steps. Secondly, stop and think and apply an equity lens. Are they getting a fair go? Next, you can act on things within your control and advocate for things you don't have control of. And finally, you can adjust your treatment plans based on your understanding of the patient's context. Let's go through each of these actions. In your patient assessment, you need to pay attention to the social determinants of health and ask the questions about what resources or enablers this patient has in this context. What are the barriers in each domain, and what's the impact? For example, for health access, that means considering physical barriers like poor mobility, communication barriers like language or deafness, cultural barriers. Perhaps there's a lack of trust in conventional medicine or trust in an alternate paradigm. And what about psychological barriers? Is depression impacting on access to care, or anxiety about needles doing so? Finally, what's the impact of all of this on the patient's care? Next, you can act on the things that are within your control. Improve care by removing barriers, creating situations that enable quality of care, and reducing the impact of social determinants. Now, this might look like including education of the patient or the family in the healthcare plan. If transport's a barrier, order the taxi voucher. If deafness is a barrier, get the hearing aid fixed. Referring to the occupational therapist might improve the physical environment, or to the social worker might improve economic stability. Or perhaps we need to change the environment completely for the patient to be at home or in hospital or in a nursing home. Engaging and mobilising community support can be a powerful way of improving care. For those things outside our control, we can advocate. We need the skills to advocate effectively to the right person with the right argument. And we can advocate within the team for the patient's concerns and to improve care. And we can advocate outside the team to decision makers who allocate the resources that can overcome these barriers. Finally, as doctors, we're responsible for formulating a plan of management. It's critical that this plan takes into account the context of the patient and is adjusted accordingly. So our education format might change if the patient's deaf or visually impaired. We might adjust our language if health literacy is low. The treatment plan to an option that requires less trips to hospital or lower cost drugs. The discharge timing until the family come back from holidays, or appointments to take account of sorry business or religious holidays. These are all adjustments that can lead to more appropriate and more effective treatment plans. So the process really requires a good assessment, some imagination and creativity about how you could make things better, some wisdom about what you can change and what you can't, and some advocacy skills. These are all skills you can practice on your placement. So good quality care requires us all to pay attention and act in response to social determinants of health. We need to remove barriers and enable quality care. Assess always, use an equity lens to mobilise support for a fair go, act on the things under your control, advocate effectively for those things you don't control, and adjust the treatment plans to take into account the patient's context. My challenge to you is to identify one thing that you're going to prioritise to change. Put it in your learning plan. Good luck, and remember, you really can make a difference. Here are some references, and please visit YouTube or Vimeo for my other talks and leave a comment or requests for other topics. Good luck.